By far the most common things we see are things like scabies and lice, which we treat immediately before those families are commingled with other families.
Dr. Jennifer Tudor is the Deputy Chief Medical Officer for San Diego County. She says when families get dropped off after being in custody, they often present with a host of ailments. The shelter, run by Jewish Family Services, screens the families to check for communicable diseases. Many of the migrants were flown in from overcrowded detention facilities in Arizona and Texas. Since January, the shelter has received over 13,000 asylum-seeking families and treated 235 cases of influenza, 746 cases of lice, and 471 cases of scabies. Tudor says the quarantine of migrants prevented the spread of the flu into San Diego.
They get new clothes that have been donated, they get showers, and then if they need to be isolated or quarantined, families are kept together, but that all happens in a very safe area where they follow all of the environmental and infectious disease protocols so that none of these conditions are passed along.
In addition to communicable diseases, many children and families arrive at the shelter dehydrated and report they lacked access to sufficient water and nutritious food while in detention. Asylum seekers also say they were held in cold facilities, referring to the detention centers as hieleras, or ice boxes. No treatment was known to be provided to the asylum seekers while they were in custody. Beyond the physical ailments contracted through their harrowing journey, many children show signs of trauma. While Dr. Tudor says the San Diego shelter is not the best place to treat the trauma that many migrants have suffered, the shelter follows a trauma-informed approach to make sure that people feel safe.
There are play areas, there's safe spots all around the shelter. It's very clear and very well enforced that there is no yelling, no screaming, no bullying, no violence, no weapons. So it's very much of a safe place.
Families typically only stay in the shelter between 12 and 72 hours before traveling on the final leg of their journey to meet family members or sponsors in the U.S. In the last 2 weeks, the shelter has seen a drastic drop in the number of migrants arriving. They attribute that drop in numbers largely to the Department of Homeland Security's Migrant Protection Protocols, or MPPs, in which families are being returned to Mexico to await their immigration proceedings. Despite the shelter's efforts, not all migrant families are lucky enough to reach San Diego and receive treatment, with many families forced back across the border to wait in Mexico and fend for themselves. Milena Spitzer, KPBS News.